Good morning. Hello, everybody. Happy Saturday. Welcome to our Natural Health News live show. I am excited to have all of you join me today, and hopefully the audio is going to be okay on YouTube. We had a weird replay audio yesterday, but I've recovered from my COVID-style birthday and have lots of wonderful food to enjoy for the next few days. So thanks everybody who tuned in yesterday for our live birthday celebration. I am grateful you guys are so inspiring to me. And today we're going to talk about a whole bunch of news. We're going to talk about some more studies and some more research that's come out. We're going to talk a little bit about what states have uncontrolled outbreak and the impact of COVID on female healthcare workers, physicians, and clinicians, as well as today's core topic. You're going to want to tune in for this. If you are watching on the live, stay with me throughout this whole thing. I've got a ton of information to share with you about how to naturally resolve migraines and to manage migraines naturally. And there are multiple layers to migraine management. There's a lot of reasons behind migraines, but specifically COVID migraine is problematic for weeks on end. A lot of COVID suffers, especially the long haulers, individuals who have COVID for weeks to several months. So if you suffer from migraines, this is going to be a great video for you because we're going to dig into this underlying potential sources of inflammation and related angst. I also have some reflexology tutorial at the end. Definitely stick with me. And again, if you're on watching the replay, you can fast forward, and that is a great way to get to that detail. But first, I want to mention this will be the last week. I will have this antiviral attack available. So if you haven't downloaded it, check in the links down below. Especially this is free, and it's available. It's got a ton of it now. I started this. I created this checklist with a bunch of recommendations, resources, tips. I have a whole shopping list of items to your body with resources to help you manage and protect your body from COVID. I'm updating this, so this is getting a revamp. But in the meantime, I'd love to share this to you or with you. It's totally free, so check it out. Link down below. Instagram, there'll be a link once this goes live. Hopefully, I had some issues this week with posting to Instagram. But I want to share that information with all of you. And just know that if you download that, you then will get instant notification when my new resource guide. I haven't labeled it yet, but it's quite extensive, and it's going to be based on a lot of the research that we know that we're seeing that certain levels of nutrients and micronutrients and certain supplementation is helping combat and level the immune system and target some of the systemic inflammatory symptoms. So that will be wonderful. So if you download this, you will technically be in my email chain. And those folks will be notified first. So, don't delay. It's totally free. You just give me your email and I send you an email with that attachment. Okay, so let's dig into the news. So the world's at 7.5, almost 7.6 million cases. We had a record-breaking day worldwide. So the world has surpassed some records here. We had over 300,000 new cases worldwide of COVID. And we are at almost 670,000 fatalities worldwide for COVID. Some noteworthy news, Brazil's at 2.66 million, India's at 1.7 million, and they had the highest day yesterday. They had 57,000 cases posted yesterday. The US is at 4.642 million. We had a big day. We had over 67,000 cases. And right now, our fatality rate is sitting at, this is just so crazy. 1 American citizen dies every minute currently due to COVID. So our shows run anywhere from 55, 60 minutes to 70, 80 minutes. So in the span of our live time or on this replay, if you watch this fully, about 55 to 70 Americans will have died from COVID during our show. That's really mind-blowing information. And I just want to share that with you. This is not fear-oriented, but this is what the data is showcasing. We are having an exorbitant amount of people die from COVID. And this, again, is not like the flu. Some people are asymptomatic and might experience flu-like symptoms, but for many, they don't. And there are more and more studies being run about the long haulers. Actually, there's a study that Columbia right now is gathering. They're gathering long haulers, the COVID, the Survivor Corp community on Facebook. They are taking in folks who can go to Columbia and sit down with researchers, and they're digging into potentially some of the reasons why they've had longer term effects and maybe what they've done to help offset that. So there's big studies coming out about the longer term effects, because this just isn't, a one and done, runny nose and a cough. There are longer term effects, even for the asymptomatic cases. We've seen heart damage, brain damage, inflammation of the brain, lung related scarring, that even cases that it doesn't take them down, they don't go to the hospital, they still have long-term effects. And we'll get to some of the more information that we have about the longer term cases. But I do want to highlight that right now, some states that posted high numbers yesterday. California remains right now in the #1 spot. Florida is really inching really close to California. So California is at 493,000 cases in total. They had a total of new cases, 8,086 yesterday, and they had 96 fatalities. Florida, they've really moved up. They're at 470,000. So they're 23,000 away from meeting where California is at right now. They posted 9,007 cases, positive new cases yesterday. And in the last 4 days, they've had a 40% increase in the fatalities of Floridians. Yesterday, Florida had 257 Floridians die of COVID. And that does not seem, just based on the numbers that they've been posting, the fatality rates are anywhere from 2 to 4 weeks delayed. And so if we look at 4 weeks ago, we might still continue to see fatalities increase. In Texas, they are at 420,000, and they posted a big day, 8,800 cases yesterday, and 295 fatalities, down from the over 300 the day before, but still high. Georgia, you guys know that's where I sit. We had 186,000. We have 186,000 active cases, 4,066 new positive cases with 81 fatalities. So our fatality rate has increased. And the worst states this week. So if we do a snapshot of the week and we look at the worst states in terms of new numbers, potential growth, Mississippi, California, Missouri, and Georgia. Those are the 4 worst states off, the states that have had the worst week across the board. The numbers of new tests, the numbers of fatalities, the number of the percent positive tests. So for all of you joining, please give me a thumbs up. I really appreciate that. And so I always get questions like Laura says, do you think the numbers are correct? So I definitely think that the numbers are what they are. They are what we have. They are what is being reported. Now, some states are still not reporting all of the numbers. Some states are only reporting what's being tested in the hospitals and not the private labs. Right now, I'm pulling from a lot of different sources. And so it is not just the CDC or, Johns Hopkins. It's a multitude. And what I do find is there's definitely some skews in the numbers. But I think overall, our numbers are low. I think whatever is being reported is not accurate. And I think it's a lot higher. And so, in terms of that, we have testing delays, we have false positives, we have, errors that are occurring where people are getting, they register online for an appointment and then they decide after two hours to bail. They screw up the whole system. And then the person behind them gets their test, it's messy. And so, are these numbers perfect? Are they 100%? No, but it doesn't change the fatalities. I mean, that for sure, we know there's, for sure, COVID-related fatalities. Are there COVID-related fatalities that haven't been recorded? Yes, I think that's pretty substantial. But this is one of those things. We are where we are. Question was, how is New York doing? New York is now in the 4th spot. They're at 415,000 cases. They added 644 new cases yesterday and had not recorded any fatalities. So they're doing okay. But where we're seeing the growth is pretty intense. One of the things too that is happening right now is that the CDC has looked at where we stand, all these increases in the positive percent tests, and they have articulated a new prediction in terms of fatalities by August 22nd. So 3 weeks away. They're saying, okay, 3 weeks, we are going to go from 154, 155 fatalities all the way up to anywhere from 168 to 182,000 fatalities. Now that's a broad range, of just under 20,000, but somewhere in the middle, it's probably to be expected. We'll probably see 177,000 fatalities to occur by the time we hit August 22nd. And that's really, really, it's just really crazy. So that also, the CDC has projected that Alaska, so several states are going to see increases in fatalities. And those are Alaska, Kentucky, New Jersey, Puerto Rico, Tennessee, and Washington. So that's really big news. I also do want to highlight, just worldwide, Hong Kong is going through all sorts of grief, but they have seen some spikes. They've employed a whole bunch of additional resources. And one of the resources is a surge-related hospital. So they've built out a surge-related hospital to offset some of the healthcare overwhelm from the positive cases that they're seeing there. And there might be situations where we start to see some of those happening in some of these states that are having these spikes. Mississippi might have additional surge, Louisiana. There are certain pockets of that, but yesterday I highlighted, let's see, where's yesterday? So yesterday I highlighted details about the state. So this is our current situation, and red being high density, based on the number of tests coming back positive, the exponential growth of community spread. I mean, we have pockets, there's red everywhere. Where we're not seeing a lot of red is up here in the Northeast, but they were red in the spring, but they've really decreased this. They've also set parameters where basically there's like a shield from allowing folks to come in. And if they come in, they have to quarantine, so they limit the spread. But we're seeing it out west. We're seeing it up in the Northwest, central mid area up here. So, there's just a lot of spread. I do want to show another report here. This is the states that have the most, the quantity of states that have the most out of control cases, and it's based on criteria. It's based on cases, the infection rate, and the test positive percentages from July 30th. The red is where we're seeing a lot of growth. So what is really crazy is look at this middle area. And so if we look at the projections, they're looking at Alaska, and Alaska is in the moderate category, but they've got Kentucky in here, Tennessee, they're all in that space, actually over here. So this is where we're seeing some out of control spread. Now we know some areas there's pockets in, the meatpacking communities, also the jails. Those have been some microcosms. Speaking of microcosms, the Major League Baseball is having all sorts of grief with COVID. There's a total of 26 new cases this week, and 8 teams who have been affected, and their schedules have been on pause. I feel like Major League Baseball is going to be a little snapshot of what school is going to look like for many of us. So that's just my little opinion there. But, they've come back together. There's some random ones that go out they travel to a city and they go out because they just can't stay in their hotels, and they get infected, and they bring it to the team, and then they're traveling around and infecting more people. And that's just the way it works. If you want to know, this is aloe vera juice with peach juice. So this is my morning drink. Okay. So other news. Okay, let's talk about Georgia. So I live here in Georgia. We've got the little communication about schools. Let me just pull up my resources here. Let's see. I have a lot of resources today. Okay, so school's been hit hard. Here we are. Okay, so yesterday, CDC posted another MMWR article, and this is SARS-CoV-2 transmission and infection among attendees in an overnight camp in Georgia in June. And I highlighted this a little bit, but now we've got full details. But essentially, this report digs into a sleepaway camp that was here in Georgia. They have not said who this camp is. I will tell you on the mommy feeds, my Roswell moms groups and stuff. Everybody's speculating as to who this is. But basically, there was a camp. First camp session started June 21st through June 27th. They had 363 campers and 3 staff members that were a part of the program. It's just one of these scenarios where kids, come together on the 23rd. So 2 days in, a teenage staff member left the camp complaining of chills. And they had the camp member tested, and then they realized that they had a COVID case. And so they then had all of the attendees and employees, staff members, tested and quarantined and self-isolated if there was a positive test. And basically what happened is, so there's the total number with staff, trainees, and attendees, 597 Georgia residents attended this camp. The median age range is 12 years old. It was 6 to 19 was the age group, and 53% are female. But basically, they tested 344 people. Among them, 260 were positive. That is 76% of the people tested were positive. They said the overall attack rate based on who was tested, who was tested, came in contact, and who wasn't. So total out of the 597, 44% tested positive in total. 51% of the ones who tested positive were ages 6 to 10. 44% were ages 11 to 17, and 33% were 18 and 21. So 33% were the trainees and the staff, and then the middle group was 11 to 17. What's concerning is the 6 to 10. We've learned a little bit more about, the contagiousness. 5 and under are a lot more contagious, but they're seeing a concentration at 6 to 10. So this has blown everybody away. Georgia particularly is freaking out about this. It happened here. We have a lot of Georgia residents who go to this camp. And the county we live in, our child doesn't go to a county school, but the county we live in, they're still aiming to start school on Monday. So I don't know what that does with the change, but more than likely it probably won't have any impact. But that's just something to know. I mean, we've seen other sleepaway camps come down with this. I think Michigan was one of them. But that's just to tell that, they all gather. We're going to have greater gatherings, even with them, the folks that are not, they're coming back to campus and they're still socially distancing. But, supposedly this camp was taking all the measures. I see Jenny says, Doc, sure that's not left over from the Bellini. I still have a lot of champagne left in the peach. I'm not used to drinking like that, especially in the morning. But it was really great. And Adrian says it's a YMCA camp. I don't have confirmation on that. I think they are very, whoever the camp is, they don't want it to get out. But it's for sure, it's not a great sign. The other thing I want to highlight, there's an article that came out, a viewpoint in the AMA, so the Journal of American Medical, or for the American Medical Association. So JAMA posted a viewpoint, and it's an article written by a doctor out of the University of California, San Diego, La Jolla. Her name's Linda Brubaker, and she talks about the healthcare system and the complexities that COVID poses among the physicians and the medical professionals, and particularly the effect on physicians and the 24/7 kind of work balance they're trying to maintain during COVID. And they talk about women physicians, particularly have challenges when it comes to family care. A lot of responsibilities still fall on the female clinicians, and that a lot of the practice providers are business owners themselves. So they're business owners, they might be healthcare executives, they might be academic physicians. But they talk about what COVID does is it highlights systemic assumptions about women physicians that may unintentionally cause unintentional disadvantages. And so this highlights the gender-related work-life balances and the strain it puts on female care providers. I thought this was great. This is really big. So for any of you who are female business owners and in the workspace and trying to balance it all, this really highlighted the impact in the clinical world, especially these frontline workers who also have childcare issues when their schools are closing. So they're not only managing trying to keep their patients alive and the major strain of having PPE and trying to protect themselves from bringing it home, a lot of that falls on themselves, which leads me to my next study. This is really big. This is out of the Lancet. So this is a British related journal article. This is entitled Risk of COVID-19 Among Frontline Healthcare Workers and the General Community. It's a prospective cohort study. And essentially this is a focus on frontline workers who have and are wearing PPE are 3 times more likely to get COVID. And this is really fascinating. It goes from March to April. And they also take a look at different pockets. So they look at London, they look at Boston. So they've got Mass General. Zoe Global is one of the partners in this study with these clinicians. And what they found, what is observed is really fascinating. They observed the breakdown of the frontline workers and also the ages of the workers and the ethnicities. They break down, who this community are that they sample. They also break down the healthcare workers and their own underlying health conditions. The frontline health workers, the major comorbidity or underlying health condition is lung disease, which is really kind of fascinating. And they're in an okay body mass, like 20 to 24 is the average body mass, the BMI for the workers. But what they found is that disproportionately, the workers that are Black, Latino, or non-white are more disproportionately impacted by the lack of PPE. And in fact, they will highlight that they don't have PPE more so than their white counterparts. But they actually highlight the risk for Black, Asian, and minority ethnic frontline. So there are 2 categories. They've got non-white, non-Hispanic white, and then Black, Asian. So they don't do a really good job of breaking that down. But they highlight that the individuals that fall into the non-Hispanic white category, their instances of catching COVID is actually higher than 3 times. It's like 5 to 7 times more likely to develop COVID. So that is very, very interesting. They said, among frontline healthcare workers, reuse of PPE and inadequate PPE were also associated with subsequent risk. And that this study broke down that the workers, the minority and ethnic oriented workers were actually asked more frequently to reuse their PPE. So, let's just take this study, add it if you are a female mom, female clinician, physician, PT, respiratory therapist, and you have a family at home, and you might be from an ethnic minority, and you've got PPE troubles. I mean, this is just a double whammy of major stress and angst. So I highlight that these are really big. There's also another study that came out. It is an assessment of post-acute care in COVID. And one of the things that we're not talking about, we're talking a lot about hospitalizations, we're talking a lot about ventilation, folks needing oxygen. But what we're not talking about is the post-ICU syndrome needs, which is acute care rehab requirements. And what's happening is if you get discharged from ICU, you've been on a ventilator for 2 or 3 weeks, you are going to have muscle atrophy. You might have bed sores. You might have all these other challenges like you can't swallow or having difficulty swallowing. Maybe you've got some of the PTSD, the brain trauma, and the delirium that goes with the neuro-COVID. And so there's this space where you are going to need rehab, and rehab facilities are actually really stretched thin. There's more discussion about us needing to take a look at rehab facilities from both space, staffing, and supplies. There's shortages in supplies. The staff are not necessarily being trained like they are. Be very contagious. Oh no, YouTube's buffering. I am locked in. Like my server or my internet connection is right here, and I don't know why I'm buffering. So one of the things that we need to highlight is that there's much muscle atrophy, there's delirium, there's PT and OT needs. Some people need to relearn how to walk, to speak, to use their muscles, retrain their muscles. And some rehabs are actually kicking out current permanent residents. They're kicking them out of the rehab to bring in the COVID patients, which puts a whole nother dynamic in there. But if they come in and they still are testing positive with COVID, now they need additional isolation, which adds to the PTSD and the situation of psychological trauma. And if they do alternatively go home, they need home health care. And this study, the Lancet actually digs in, or not the Lancet, but this particular study, this digs into the individuals who are at home with home health care. Only 2/3 of home health care companies are actually catering to COVID cases. So 1/3 are not even equipped to handle COVID. So home health care also poses a whole bunch of other issues with, they're going from home to home. What's the infection possibility as these people go in and change PICC lines and all these other things, and they're, meeting with families and administering medications and doing therapies. This is really, really challenging. Kathy from Texas says, what is the proper placement for a resident testing positive in a nursing home hospital? Traditionally, yes, they should transfer out to a hospital, but Texas might be different. If you're in Texas with the ICUs being at capacity, they may be having them managed in that setting. I don't know. I mean, and same within Miami, like Miami-Dade's at 170% ICU capacity. That is insane. It's just that growth. So I don't know, but I do know there are major gaps, especially in home health care, that will harm their recovery. And this is something care providers are just ill-equipped. I mean, you're already dealing with, oh my gosh, my loved one survived, like hallelujah, right? But now you have to figure out, is home health care the best? Is rehab an option? What's the risk of them going into rehab and catching or having other infections? I often would get called into rehab settings, and some are okay and some are good and some are not. And how do you know that? And sometimes you don't have a whole lot of time. Like they're just transferring out and you're just kind of going with it. So a lot of it's covered by your insurance providers. And so there's just, it's a lot. But I wanted to highlight that because that is really a critical element as we deal with more and more cases. And, so it's not the fatalities, more and more people are recovering. So that is a good thing. But the recovery is just not like, oh, you get out of ICU, you got your bag, you're carrying, and you are walking yourself out of the hospital. That doesn't work. It doesn't work out that way. They are being wheeled out. They often are getting transferred or need additional care. And I see Lori says, friend's brother-in-law has lasting damage from COVID and a respirator. Yeah, and that is something that's where we talked about, I think a month ago, they were talking about people would have permanent, they'll have permanent disabilities from COVID. So speaking of COVID, let's talk a little bit about migraines. And I actually want to, I printed out my reflexology stuff. So I want to highlight specifically, if you have COVID and you are, recovering, or, you're managing this at home, I mark my time, 30:24. If you're recovering at home and you're dealing with migraines, or you all the time deal with migraines, maybe it's hormonal, or maybe it's allergy related or environmental pressure changes, today's video is going to be really specifically aimed at helping you deal with this, because there's a lot of different ways to target migraines. One of the things is one of the major underlying symptoms that is present with COVID are headaches. And part of the headaches are the neuro-COVID, the brain-related inflammation, the breakdown of the blood-brain barrier. So that becomes its own kind of challenge. But specifically today, I want to talk about migraines. Migraines can trigger nausea, they can trigger vomiting, they can trigger light sensitivity. People can also have vision changes, tingling kind of sensations throughout their body. Some people with different migraines, it affects different areas of the head, or they'll kind of feel like it's back here, or it's over here, or feeling it right here, or behind the eyes. So it can be located in different spots. Some people need to be at home under the covers with darkness, total blackout light, black out their windows and be left alone. Regardless of your situation, I want to highlight several different ways to tackle migraines. And the first way is, a lot of times migraines are hormone oriented for men and women. And one of the things that we see is that for women, they'll tend to spike with the ovulation time and then right before their period begins. So there's definitely some imbalances with the neurotransmitters and the neuroendocrine hormone balancing. So balancing hormones is critical. I have a lot of video specifically about that. I won't get into the details of hormone balancing, but definitely for men and women, it's not a bad idea to make sure that you have your hormones checked regularly, that you're seeing an endocrinologist or some provider that is managing your levels of estrogen, progesterone, testosterone, evaluating your thyroid levels, as well as assessing your stress hormone levels, because those all play a role in hormone balance. For my females, particularly that have hormone-related migraines that are linked to some of those changes in the hormone cycle, shatavari is my favorite herb. And I haven't posted it today, but I'll post it down below. Shatavari is my favorite Ayurvedic herb to balance female hormones of all ages, all different spectrums of ages and cycle phases. Now, the other thing that becomes really critical are micronutrients. So a lot of times people will notice that their micronutrient levels are deficient. Sometimes they get their Bs run, but not a full complex. They'll just analyze B12, or they might look at folic acid levels, or they might also assess if there's some anemia there. But micronutrients like magnesium, so a good magnesium glycinate is critical. Magnesium and a good B complex. So this is my favorite B complex. This is a liposomal. You just squirt, do a few pumps and hold under your tongue, and it gets immediately integrated. Bs are very powerful. Some of the things that I've mentioned before, this is my mic cord. Our nerves in our head, throughout our body, our central nervous system, there's a sheath, a covering that protects our nerves. And a lot of times that sheath will get eroded from aging, free radical damage, inflammation. And the nutrient that repairs that are your Bs. And so you need good healthy cord to minimize the inflammation. Is that in full script? Yes. So shatavari, magnesium glycinate, and the liposomal, everything that I'm going to talk about is in the full script store. So if you guys want to check that out. And stress, Ritter says stress has played a major trigger. Stress is totally a factor, and that is a hormone. So stress hormone can play a big, big role. So managing your cortisol. But your micronutrients, magnesium and Bs, are critical, and you should take them regularly so that you minimize deficiency. And with Bs, if you have a methylation challenge like MTHFR gene mutation, there are versions of this liposomal that are methylated. So this, I don't need the methylation, but there are the liquids for methylation, which means you need a methyl B12 and a methylfolic acid or methylated version. The other thing I also want to highlight is diet plays a big role in migraines. So a lot of times folks are eating items or foods that will trigger migraines. And I want to list some of the common triggers. Processed foods, especially nitrates and nitrites. So, processed meats, bacon, some of those foods that are packaged and they've got lots of things inserted in them to keep them preserved. Those are highly caustic to the brain and can trigger migraines. Wine is a big one. The sulfates in wines can really cause all sorts of headaches, literal headaches. The other thing is any type of alcohol. So even your harder alcohols, and even your infused, alcohol beverages. They've got the wine spritzers or the seltzers and things like that. So anything that's in the alcohol category qualifies. Caffeine is a big trigger for a lot of people. Dairy can be sometimes a trigger for individuals, and chocolate's a big one. So I want to put that out there too, because sometimes you might be dealing with a B deficiency, you might be drinking caffeine, and you might have a little alcohol at night. Well, if you eliminate those, eliminate the deficiency and eliminate some of those food sources, you might actually have some eradication. Now, folks in the COVID world, most of the time, they're not going to be consuming a lot of caffeine or alcohol. They're really tuned into, keeping their bodies hydrated. But these kind of core facets, making sure the micronutrients are rich. Also, herbals. I love to incorporate herbals. My favorite is a plant that's grown and named after its beneficial property to reducing fevers. It's called feverfew, but it also is powerful at reducing migraines. And where there is a high fever, there's often dehydration. And where there's dehydration, there's often a migraine or a headache. And so the headaches are one of those things where you can address the headache by dealing with the root, which might be a high fever that's dehydrated the body and you're lacking electrolytes. So drinking coconut water, bone broths during a COVID recovery, or when you're convalescing with COVID, will keep you hydrating well and giving your body the nutrients. Then additionally supporting with feverfew, and ginger is another good. There's a study in 2014 about ginger and its ability to reduce the pain of migraines and headaches. Very powerful. I actually recommend Inflamex. You can find this in full script. Inflamex is really beneficial at reducing inflammation levels. It also has the core plant derivative for aspirin. So it has white willow bark. White willow bark is pain relieving and anti-inflammatory. It has ginger. It has turmeric and bromelain. Bromelain will reduce also some of the brain inflammation, the swelling in the brain. Best coconut water, DWT277. Best coconut water, I like Zyko. You have to watch out. There are a lot of coconut waters on the market that just are not 100% pure. You have to read the labels. Sometimes they'll have ascorbic acid added, totally unnecessary. Coconut oil or coconut water is nature's created coconut water to be pure, and it doesn't need a preservative in it. I mean, it sits in that shell and it's preserved. And so you just watch for that. I go pure. Actually, we now order ours. It used to be my go-to for Trader Joe's. Now I just order on Amazon coconut water, but it's very potent. The other thing that I want to recommend are oils, topical oils. You can apply topical oils, and we'll talk about the acupressure points in the reflexology kind of portion here. But you want to make sure you have coconut, or not coconut, but peppermint, pure peppermint oil, pure lavender oil. I like French lavender oil best. It's a little bit more expensive, but more potent. And then also you want to have the Sea Bumblebee D cream. And that is code for my herbal botanical. And I have a new link. I'll post to that for my favorite brand, but they have a little menthol. So it's got some menthol pepperminty plus the relieving aspects of the Sea Bumblebee D, the B being the middle initial. Very potent. And you can apply that on certain areas. I love to apply it over the carotid and right here and over the temples, and sometimes in the back of the neck, depending on how intense the headache is. You can also employ acupuncture in a normal situation. With COVID, it might not be a good idea, especially if folks are dealing with COVID. You're not going to be going to do practitioner or going to a practitioner's office, but you can do acupressure or what we call reflexology. So we'll talk about that. The other thing is massage. You can do massaging, if you can get some of those independent massagers, sometimes there's mats that you can lay on, another family member can massage, but there's a lot that you can do. I just need to check on Instagram. My battery on my phone, we've got 9. Okay. I have 9%. I'm going to go for another 7 minutes on Instagram and I'll probably wrap up. But definitely run over to YouTube for sure, to join me. So Instagram is reliant on my phone, and I forgot to charge up my phone last night. Okay, so I want to share with you some core reflexology points that will relieve some of the symptoms. So there's one point, and it's right here. So this point, basically like right between your eyebrows, that point right there. And so you can take your middle finger and just press in that spot. And you want to kind of hold for 5 to 10 seconds. And that will alleviate some of the eye strain that goes with headaches. It'll alleviate ulcer pains, and it can alleviate some of the lack of concentration that occurs with the neuro-COVID. But, just kind of hold it. You can hold it up to a minute, but that's a good point. You can also, if you don't want to hold, see, I get really red. You can do like a circular pattern here. The other thing is grab your oil, and, around the eyes, you want to be really careful. You don't want to go overwhelming, but you just do like a little dab and then just a little point of the oil. And that can help also open up the sinuses, because sometimes the sinus pressure up here will feel like a migraine. It's just sinus pressure. And that is definitely the third eye. Now, the other thing is, if people are experiencing sinus headaches, allergy-related headaches, as well as congestion, which can go with COVID, then there's 2 points right here. Now, this is one of these things where if you've done oil here, you want to wash your hands. You do not want to get any essential oils near your eye. Includes the sea bumblebee D. But what you do is right here, right in here, you want to press. And it's going to feel a little weird, but you can press with your thumb in that space, and you just press for a minute. But if you feel tenderness, like I feel tenderness more on my right, and my right is the side that I have more of my allergy related symptoms. So, and I've been experiencing allergies. We've been doing a lot of gardening, but that will alleviate a lot of the related pressure pain. So it's just the inner corner of the eyes, just below the eyebrows. And we call that bright light in that area. Now, the other area that is very beneficial are the temples, or the temporal area. And there's several kind of points that you can address. I first like to do a little bit of a circular pattern. I put a little bit more pressure in this space, and you just do a circular pattern. Now, if you deal with TMJ or ear fluid pressure changes, this will help. You might get some crackling going on your ear. So you can do this kind of circular pattern. Once you do that, then you're going to go up and in around the ear. And so you can press right here, and you keep pressing right around the ear. And so there's certain points through the ear that, and let me get my hair back. You'd press here, here, up here, and then you start to go down. And you just press in. You can press those for 10, 15 seconds, up to a minute, depending on how people experience the pain. And so sometimes you might get, this is kind of the temporal region, you might get some relief. It might be simultaneous. It might be, a little bit it might take a little bit of time, but we call, the hairline curve, the valley lead, the celestial hub, floating white, and then we call a head portal yin. So these are all the reflexology names. Okay, so this pressure point here, this will relieve temporal related pain. Okay, now the other point that I want to recommend, and let me look at Instagram. Okay, so Instagram, I'm going to cut you guys off because I'm just at under 5% on my battery. I want to make sure this can upload. So Instagram, run over to YouTube. Join me. It's you go to youtube.com/c/ and then Natural Health Resources. You'll get my channel. Just search Natural Health Resources. Join me there and I will go over more details. All right. See you guys later. Thanks for tuning in. Okay. So let me save this. Let me say this really fast, friends. Okay. So I saw Pat wanted people to know if you get email saying you changed your passcode, act immediately. Oh, Twitter account was hacked. Oh, geez. Yeah, Twitter has not been having the best of they seem to be a hacking source. Okay, let me share to Instagram. Okay, I'm doing this really fast. Okay, I just share this really fast. So COVID, we call it natural migraine relief. Okay. All right, so let's see. Oh no, don't die on me. Oh, it's giving me grief. Okay, hopefully it downloaded it. Yeah, okay, it's posting it. Okay, sorry. I had some issues in the last 2 days. Okay, so now I want to talk to you a little bit about there is a facial point that can be really good for tension, stress-related headaches. So there's this little point right here. So basically, at the corner of your nose, you just kind of do a little space out, and you can press that in. And it might feel a little weird because you're also pressing along your gums, but press there. This is for tension headaches. And this can be really good also if you're dealing with closed sinuses. So if you're dealing with sinus pressure, it will help relieve that. So I love that. We call this welcome fragrance. And again, this is one of those things. You could do a little oil if you wanted to, but it's close to the nasal passages. Any mucosal membrane, I really avoid getting any oils in that region. Okay, so that's one area. Now, the other area is very potent at relieving a lot of the just overall headache pain, especially when you're having migraines and it just feels like your whole head is going to explode. So I'm going to turn around and share with you. It's at the base. It's just at the base of the neck, and we call it wind pool. It's at the back of the neck between your ear and your spine. And so let me turn around here. Okay, so this space right here. So if you've got your hair, I should have brought a hair clip, but it's basically between your ear and your spine right here. So this space, and it's just below where your hair hits. You want to press that area in, and you can do circles. But a lot of times there's actually, I'll share with you, I'll grab a link. I'm hoping it's on Amazon, but there are these two little red rubber ball things that you can, it's a flat surface and then it has like two little balls. And you could put that on the ground and I will press on that. Oh my gosh, it opens up your sinuses. And the other thing too is if you're lying down on a bed, you can take your hands, make a fist, and literally as you're laying down, you're pressing this part of your fist into that region. That will really clear a lot of pain. And then the one other area that a lot of people know about is right here. And so this reflexology point just right there, you can pinch that and that will alleviate a lot of pain. This is great for a lot of different pain in the body, but this is a good point that can release some of that, the sinus pressure, but also the intense migraines, the intense headaches, and it just relieves. It relieves a lot of that intensity. So I wanted to recommend those for all of you. Let's see. You love the demos. Okay, so. The Rad Gadget, I don't remember what it's called. I've had several acupuncturists that have worked for me in my center, and one of them had those. And I mean, I bought several. UPS is here. Sorry, guys, hold on. I don't know why. At least they knock. A lot of times I need to put a sign out. Okay, I need to put a sign out because a lot of times they ding on the doorbell and the dogs go crazy. Hi, Daisy. You want to say hi to everybody? Come on. Daisy wants to say hi. Come here. Oh, come here. Say hi. There's Daisy. Say hi, puppy. There's Daisy. Okay. All right. So sorry, you guys. I hope this is helpful. I really, the pressure points on the body are really good. So acupressure is a good alternative when you can't get acupuncture. And because of COVID times, I don't advise it. And I know I have a lot of colleagues in this space that are back to seeing and treating people. I just don't think it's smart for anybody at this point, especially with the sense that, every clinic is different. Some, I'm hearing more reports of people, clinicians, techs taking their masks down. It's just crazy. So, it's a sure thing when you can do it on your own. If you guys really like this particular style video and you want me to break out some of those acupressure points on their own, let me know. I can try and do that. It'd probably be something I'd do separate from this video, but definitely let me know if you like it. Oh, good. Phyllis. Hey, Phyllis. Massa is coming over from Instagram. Pressure points for headaches. Life with Janie, I've already covered those. So I definitely have you watch it on the replay. And it starts, if you want to start at 30 minutes and 24 seconds is where we get into all of those points. Cindy, can you talk about joint and muscle pain from COVID? Yes. Okay. So there's definitely a lot of joint and muscle related pain. The joints and the muscles don't have nearly the amount of receptivity to COVID, but it definitely does trigger a lot of aches, and people experience weird feelings like sharp shooting pains. Numbness is a big experience that I've noticed people commenting. Even today, like somebody posted on the Survivor Corp, I showed Brian, I was like, look at this. Their fingernails, under their nails, it was black, like purple black. So these weird circulation challenges, and some of that might be the micro clotting that does occur with COVID. We do know autopsies, they've identified all of the major organs, glands, and even soft tissue is demonstrating microclots. So that could very well be some of that. I also think too, we get those aches and pains when our body is in a battle. And so an immune battle, and I think that's part of it. Msm Sulfur Crystals, yes, that does help. I do not everybody can handle MSM well. Some folks that have detox challenges, it can be really overwhelming. So I like the kind of gradual. I did forget to mention this. Let me mention this. Homeopathic wise, Nux vomica sounds really awful, but it can be very good for the major intense migraines. So any of my folks that are like, I'm down and out a day or two with migraines, this is really helpful. It also is very good for any type of headaches, as well as any type of nausea or vomiting. And flu. So this is a really good homeopathic that I would be recommending or would put on the list for any COVID situation. So that I hope is helpful. Should they take proteolytic enzymes with K? You can. I mean, proteolytic enzymes are those metabolic type of enzymes that help to eradicate inflammation, and some like nattokinase can be beneficial in reducing the clotting. there are different functions and different aspects that these enzymes target within the body. And globally, they're helpful and most beneficial when they're all taken together, like serapeptase and some other enzymes. Okay, so you guys like this. Okay, let's see. I want to see if there's any. Yeah, so the red gadget, I'll get that detail. Holly's had migraines 11 years old till 21 years. Pregnancy stopped them. Now I have occasional cloudy eye issues. PC says it's migraine without pain. Yes, you can have migraines without pain. It's just a lot of times it's brain-related inflammation. So if you overall address your inflammatory levels, you're going to be having a much happier body experience where your body won't be feeling as overwhelmed. Marina V, is there anything for numbness and tingling? I have numbness and tingling with my migraines all over my body. So one of the things that migraines do, and this is your central nervous system and your nerves, but there's inflammation in and around the nerve bundles. And now you've got the nerve. So let's just say, my little wire is your nerve circuitry. So you've got, circuitry that runs down the spine and then out towards, say your elbow. So if you've got inflammation here, the wirings, the signal is going to be all whacked out. So it gets kind of kinked, and then you're going to register that in pain here. So it's really, the root is in the brain, but you're feeling it at the end of the elbow. And so you can address, you can do the topical serums and things like that along here that can, address some of the inflammation that's localized, but it's coming from in here. So I do the acupressure points. I do a lot of anti-inflammatories, the bromelain. This Inflamex is great for migraine relief. Especially the white willow bark is very anti-inflammatory and pain relieving. But the numbness and tingling is from that inflammatory response. And it can reverb all the way down to the toes of your body. It can be really crazy. Maria, thank you for the belated birthday wishes. I appreciate that. Okay, so you guys like this topic. Okay, so yeah, Paul is right. You want to make sure you're detoxing. Toxicity is definitely a part of migraines. I like diffusing the oils as well. I think that's helpful. So, all right, friends. So thank you for tuning in. I really appreciate all of your time. I hope this was helpful. Definitely I'll look at putting this on my list. I've got a little Post-it note board over here of all my content topics that I need to shoot for you. And tomorrow, expect a video coming out sometime, probably in the middle of the day. So that will be an edited version. And then tune in on Monday. So thanks for tuning in. I hope you guys all have a great day. And I'm going to enjoy some more birthday goodies today. All right. Thanks, everybody. Have a good day. Bye.